Hi, my name is Chip, and I'm a paramedic instructor for the state of North Carolina. We're going to talk briefly on how to treat a fractured wrist. If you have someone with a fractured wrist, typically they're going to be holding it in a position of comfort on their own. We want to make sure that we're not going to move it and cause any more damage. So first, we want to make sure we want to assess it. Let's just say there's some deformity there, an injury. A couple things we want to do. Number one, make sure the patient's sitting down because they can get dizzy from the pain. We don't want them to fall down and cause any more injuries. Use a gauze, a washcloth, anything that's comfortable in a hand is called the position of function. We want to make sure that we get them to hold that because spasms and things can happen later that can cause the hand to curl up and cause more problems down the road. Once we get that done, you can take anything as simple as a magazine. They make great splints, a nice thin magazine, and we can kind of lay the arm in there and have the person actually help hold that a little bit. If there's any voids in there, we can take and pad those with some of our gauze. Or again, washcloths, anything that's going to help pad some of those little voids in there a little bit. And then once we do that, take any kind of a wrap. It can be a tape. It can be any kind of cling or commercially available device that's in your first aid kit. And we can take and go around there a couple of times. Kind of hold that in place for us. This stuff happens to stick to itself, so it's a little easier to use. Be careful we're not going to jar it too much because, again, we don't want to cause any more injury. Make sure that's somewhat secure. Again, have the patient continue to hold it. I want to make sure that, can you move your fingers for me? Can you feel that okay? Blanch the nail beds. You'll see a color change. That lets us know that there's pretty good blood flow going, so hopefully there's not any kind of artery or vein involvement with this particular fracture. Typically, if the patient just continues to hold it on their own, that's going to be better. Again, their position of comfort. If not, we can put a sling around their neck to kind of hold that up for them, or we can even prop it on a pillow and let it rest there as we take them to the hospital. If for some reason they don't have good sensation or if they're feeling dizzy or weak on top of this, you definitely want to call 911 very quickly. But typically, basic fractures are not life threats unless the bone is protruding or they're dizzy or weak on top of that. And this is basic treatment for a wrist fracture.